It can be strange to reach the age of 50, which means 50 years of life, 50 years of knowledge, and maybe even 50 years of more freedom as children grow up and become more independent. With more time on your hands, now is a great time to put your health first, especially since the signs of age are becoming more obvious. Researchers have found that the 1950s are a very important time to start focusing on good health and living a healthy life. It is well known that getting older means getting wrinkles, graying hair, and a higher chance of long-term diseases like heart disease and high blood pressure. There are, however, some changes that may have caught you off guard this decade. To keep your body healthy into your 60s, 70s, and beyond, you need to understand these changes and learn how to deal with them. In this video, we will talk about some less-known facts about getting older in your 50s and give advice on how to stay healthy and active during this important time in your life. Your muscles start to shrink. When you turn 50, you reach a big milestone. You become wiser and may have more time for yourself, but your body also starts to show signs of aging more clearly. One big change is that muscle mass slowly goes down, by about 1% to 2% per year on average. This is because growth hormone levels are dropping and cells are changing. This loss of muscle mass isn't just a physical issue. It can also make it harder to do daily tasks and stay independent. This process can be slowed down, though, by doing weight-bearing and resistance training regularly. This shows how important it is to include planned physical exercise in your daily life. Getting enough protein is also important to stop muscle loss. For maintenance and growth, 20 to 30 grams of protein per meal is suggested. Overall, taking charge of your health and exercising in your 50s can have a big effect on your later years' quality of life and independence. Go to the bathroom again and again. As you get closer to 50, you may need to go to the bathroom more often, but the stream may get weaker or it may be hard to start and stop. This is generally caused by benign prostatic hyperplasia, BPH, which is when the prostate gets too big. About half of men aged 51 to 60 have this disease. As you get older, your prostate gland gets bigger. This puts pressure on the urethra and makes it harder to control your bladder, which can make you need to go to the bathroom more often or right away. To get rid of these symptoms, you might want to cut down on caffeine and alcohol, do pelvic floor movements, and stay away from fluids before bed. Medication that relaxes the muscles in the prostate or shrinks them can also help, as can minimally invasive treatments or surgery for severe cases. If you are facing the issue of going to the bathroom again and again and want treatment for this issue, then go to the description and watch our video on this topic. Strange things may grow out of your skin. In your 50s, you may start to see skin tags, which are funny-looking growths of flesh on your eyebrows, underarms, neck, or other places where your skin rubs against itself a lot. By age 60, almost 2/3 of adults have at least one skin tag. This is more likely to happen to people who are overweight, have diabetes, metabolic syndrome, or a family history of skin tags. After age 50, other growths may also show up, like brown barnacles or red cherry angiomas. If these growths bother you or make you look bad, a dermatologist can get rid of them in a number of ways. Hearing loss after 50. By age 50, you may notice that your hearing isn't as good as it used to be. This is a common problem, as a Johns Hopkins University study shows that 1/3 of men over 40 have hearing loss that gets worse with age. Noise contact that lasts for a long time, changes that happen as you age, some health problems, and the side effects of some medicines can all lead to this loss. For guys in their 50s, hearing loss is often ignored because they don't think it's important. A long-term study, on the other hand, found that hearing loss that isn't treated is tied to bad things, like a twice higher risk of dementia. To lower these risks, people over 50 should get their hearing checked, and hearing aids can help avoid falls, cognitive decline, depression, and social isolation. Things might not go as well in the bedroom. For many men, getting older means changes in their sexual behavior. For example, about 26% of men in their 50s say they are unhappy with their erections, and that number rises with age. Even though sexual health problems are talked about a lot in the media, the truth about them can still shock people. First-line solutions for erectile dysfunction that work well include prescription drugs like Viagra, Stendra, Cialis, and Levitra. A healthy lifestyle, which includes regular exercise and a good diet, is also very important for preventing diseases like high blood pressure and diabetes, which can make it hard to get or keep an erection. If you want to know how saw palmetto improves sexual health, then go to the link and watch its several benefits. If you also want to buy saw palmetto supplements, then go to the link and easily buy them. When you hit your 50s, a time of knowledge and maybe even more freedom, it's more important than ever to put your health first because the signs of aging become more obvious. During this important decade, men may go through a number of changes that may come as a surprise, such as losing muscle mass, having problems with their sexual function, having to go to the bathroom more often because their prostate has gotten bigger, getting skin growths like skin tags, and losing their hearing. These changes show how important it is to take charge of your health by doing things like working out regularly, making changes to your food to keep your muscle mass, and changing your lifestyle to deal with or avoid common age-related conditions. Make sure you subscribe so you don't miss out on more interesting videos like this.